1, 2, 3, 4, 5.
It sounds tedious, but as these nurses are learning, these counts are vital to every surgery.
What is important to note of why the count is correct?
That just means that there's no surgical instruments or any sponges or miscellaneous items left in the patient.
Exactly.
Moving on to sharps.
Before the first incision and before the last stitch, the team counts every single item on the tray to make sure nothing was left behind. But if there are distractions or an emergency and that count is off, the pressure is on.
And your circulating nurse in the room is, searching the garbages, the linen, under the table, or sometimes just recounting the sponges because they could still be stuck together.
And there are plenty of hiding places inside the patient.
Feel your stomach right now, it's flat, but during lots of procedures we'll inflate that, so it actually can make quite a big cavity. So that's why it's imperative that we do those counts, because when you do make a bigger cavity, it can be easier to lose stuff.
It's a moment surgeons dread.
It's frustrating because we know that we need to look for the missing instrument or the missing sponge. And if we can't find it, we need to take x-rays, and that adds a lot of time and frustration for the entire staff.
It's one of the many reasons Dr. Theodor Grancherov developed the OR black box. It records audio and video of surgeries so teams can learn from past procedures and see where things went wrong.
The black box has shown us things that we didn't notice before. A typical example, one of the first things that we learned was the number of distractions in our operating theaters.
So St. Michael's Hospital is eliminating some of those distractions. Other hospitals are starting to use the black box, but not all of them.
1, 2, 3, 4.
So for now, these nurses will have to stick to the basics.
So Katie, can we go back to something the doctor just talked about in terms of distractions? What kind of distractions?
Well, you're in a pretty acute situation. There's a patient on the table that you're directing your attention to, but there are machines beeping, there are people coming and going, and that was one of the problems that they had in the surgery theaters, that too many people were coming in and out of the doors. That was a distraction, so they've limited now the amount of times that people can come in and out of the surgery theater during certain procedures.
So I'm just imagining if you're at home, you've either just had surgery or about to, this is a bit terrifying. What do you look for in case you fear this has happened?
Everyone knows that surgery hurts afterwards. It's going to be tender and sore. What you're looking for is acute pain, far more than what you would expect for this particular procedure, whatever you had. And also you're looking for fever. That could indicate that maybe something was left behind, a foreign body, and there's an infection.
And advocate.
Always speak up for yourself, yes.
Okay, Katie Nicholson, thanks very much.
You're welcome.